Great. Thanks, Joe. And I would also like to thank all of you for coming. I know a few of you even took red eyes, and you're brave from the West Coast to take red eyes and come to an exciting meeting like this. It's my pleasure, and has been my pleasure, to chair the committee that developed this workshop and to have the job of getting up and down many times today and keeping us on schedule and sharing ideas with one another. I think if you look at the agenda, you'll see it's a fabulous agenda. And I, for one, when I looked at it last night on the plane, just got more excited as I came closer to National Airport. Michael has pointed out that this is part of a tradition, the Learning Healthcare System entity and work. And I would say at the start of this that we haven't realized the ambition of the Learning Healthcare System, and many of us can recall how excited we were when the Crossing the Quality Chasm report came out, and I, for one, am still disappointed that we haven't made it. But I think that one of the things that Joe points out in his introduction and my own thinking is that I think this workshop could be a marker event in terms of how we achieve this learning healthcare system of clinicians and researchers beginning to work together, create that continuous learning, the virtuous cycle that's described in Sarah Green's article, and really improve the care that we provide our patients and the health of our communities. And if that happens in the next day and a half, I will be extremely happy. I think it is going to happen, and it's up to us to make it happen. What we have on the agenda is a day and a half of several aims that are in the beginning of your packet. We write, broaden and deepen your healthcare system's leadership awareness of the prospects for and from a continuously learning healthcare system. I think that's fairly self-evident, but this is about leadership. And the second workshop that Michael alluded to talked about a CEO workshop, so we're gearing up for that workshop. Secondly, foster the development of a shared commitment, vision, and strategy among health system leaders for building and maintaining the network capacity. This is the old Tom Wolfe question. Are you on the bus? This is a time to get on the bus. And Bob Press will remember the bus from our internship days. And I think it's kind of exciting to be here at the beginning of that journey. I shouldn't say the beginning, but at a real important point in the journey. To identify common applications in meeting health systems' responsibility for science, technology, ethics, regulatory oversight, business, and governance. And the task forces that you saw on Joe's side, many of them are represented in those domains as part of the PCORNet organizing enterprise. Consider and learn from models and examples of productive integration of research with healthcare delivery systems. What you're going to hear is some of the best and most accomplished people and systems that are actually doing it. And I would remind you that as you listen, and I think our speakers will agree for me, this is an aspirational journey. Every one of us who aspires to achieve this endpoint wishes we could do it better. And I think that's one of the things that PCORI and PCORNet is going to offer us the opportunity. Explore strategic opportunities for executive, clinical, and research leaders to forge working partnerships for progress. Again, Michael mentioned that we're going to come together at meetings like this and elsewhere to make that happen. And then consider the particular opportunities for CEO leadership in building, growing, and making full use of the infrastructure. If we don't have the CEO leadership behind all this, we're going to be missing something extremely important. And we all know that for quality and safety, CEO leadership is critical. So what we're going to have today and tomorrow are case examples, an attempt to define the value proposition of continuously learning healthcare. Our committee talked a lot about what is the real value proposition. Can we come to agreement on either what it is today or what it needs to be for the learning healthcare system to work? And I will tell you that at some point between meetings, there will be a very brief survey that we'll be sending out by electronically and try to get some ideas that have formed as a result of this meeting. We'll explore the conditions for sustainability. Joe mentioned PCORI can't sponsor networks forever. And so what are those conditions for sustainability? Regulatory oversight, as Joe mentioned, and then the governance issues that relate to how we accelerate progress and how we share data together. The format is one, if you looked at the agenda, it's generally a brief presentation followed by a moderated discussion, or longer presentations followed by reactor panels. And we've designed this to be an exciting, move along quickly kind of session. And so my hope is that, and I think it'll happen because I know who's around this room, that this will be lively, and that uppermost in our minds as we have this discussion is bringing together the two communities, researchers, people responsible for delivery of care and leading the delivery of care, and end up with an aspirational idea of where we're going to go. The housekeeping, very quickly, we're going to have a break at 10:15 and lunch at 12, a break again at 2, and adjourn for a reception at 5. All that will be nearby. We're having a webcast, so all of us are on the web right now. And as you are on the web, we'd ask that you activate your microphone when you're speaking and when you're not speaking, because the noise will pass through. And the same thing with the panelists. When you're not speaking, have your microphone off. The slides will be posted on the website, and speakers' biographies are in the folder. And anybody tweeting, please use #IOMPCORI hashtag. So I'm not a tweeter, but everybody else knows what they're doing with that. And with that, I will close our opening session. And our first session is going to be led by none other than our good friend Hal Luft, who's the director of the Palo Alto Medical Foundation, professor emeritus at the Phil Lee Institute, where he was the director from 1993 to 2007, and also a member of the HMORN governing board. So Hal, the floor is yours, and you can bring your panelists up.